And welcome to this webinar on non-pharmacological interventions for chronic non-cancer pain, the science of mindfulness. I'm Krista Bergquist, as I already mentioned, so I'm the program advisor with CADTH in Saskatchewan. As I'm currently joining you today from Regina, I'd like to begin by acknowledging that the land in which I gather is Treaty 4 and Treaty 6 territory, and the traditional territory of the Cree and Saulteaux, Assiniboine, and Métis. So today's presentation will feature three speakers. The first is Colleen Donder. She's a knowledge mobilization officer at CADTH and will share with us the evidence pertaining to mindfulness for chronic pain management. We were fortunate to have Colleen join our CADTH team as a knowledge mobilization officer in October of 2018. She's a pharmacist by trade and graduated from Dalhousie University with her Bachelor of Pharmacy degree. Prior to joining CADTH, she completed a hospital pharmacy residency and worked as an academic detailing and clinical hospital specialist or pharmacist. Next, Dr. Vo will present on the clinical aspects of mindfulness for chronic pain. Dr. Vo is a pediatrician specializing in adolescent medicine and a clinical associate professor and division head for the Division of Adolescent Health and Medicine, Department of Pediatrics at BC Children's Hospital and the University of British Columbia Faculty of Medicine. His main clinical and research areas of interest are in stress and health, resilience, care and advocacy with vulnerable and marginalized adolescents, integrative health, and mindfulness-based interventions with youth and with healthcare professionals. He is the founding director of the BC Children's Hospital Centre for Mindfulness, which has the vision of supporting mindful community compassionate care throughout BC Children's Hospital and beyond. And lastly, for our third speaker today, we'll have the pleasure of hearing from the patient perspective. Virginia McIntyre is here with us today to share her journey. Virginia developed persistent pain in 2009, and by incorporating mindfulness as a routine activity, she lives well with her pain. Virginia holds a bachelor's degree in sociology, diploma in radiological and magnetic resonance imaging, and has completed professional development courses in communications and social media marketing. Virginia uses her educational background and lived experience to lead initiatives to support others. She takes any opportunity to present on living with pain in hopes to increase awareness and reduce stigma around persistent pain. Virginia has extensive experience locally and nationally advocating for those with chronic pain and is committed to helping others who live with pain as well. We will allow time for questions following the presentation, so please type those in the chat box throughout the presentation and we'll address the questions near the end of the session. An evaluation survey for the webinar will be provided at the closure of the session via the webinar platform. So it'd be great if everybody could take a couple moments to complete this survey before logging off, because it really provides us with the opportunity to evaluate your webinar experience. For anybody who is not able to attend today, or unfortunately those that are maybe having challenges with our audio, this session will be recorded and will be made available for viewing following. So again, I'd like to thank everybody, and I will hand it over to Colleen.
Awesome, thanks so much, Krista. So next slide, please. So Krista already covered the speakers, so I'm going to move right along to the next slide. So just for completeness sake, just to have our disclosures, CADTH is funded by the federal, provincial, and territorial ministries of health and receives application fees for 2 different programs listed on the slide there. Next slide. And for other disclosures, I don't have any relationship with any industry or anything like that. And CADTH did provide honorarium for Dr. Vo and Virginia to be with us here today. Next slide, please. And I just wanted to give acknowledgement to everyone who had a role in making this webinar possible. So we had a mindfulness webinar planning committee and the authors of the CADTH reports that I'm going to be discussing today, and also additional support from CADTH, the implementation support and knowledge mobilization team. So thanks to everyone who made today possible. Next slide. So just for those of you who are not familiar with CADTH, just a brief intro. We're a non-for-profit organization, and essentially we look at the evidence to help healthcare providers make decisions regarding drugs and medical devices. Next slide. And just a little bit about what we do. We have a bunch of different products where we look at evidence, and we do also health technology assessments and make recommendations and provide advice on different pharmacological and medical devices. Next slide, please. So I know I'm speeding right along, but we just, in the essence of time, I'm going to be jumping right into things. So I'm going to be discussing the evidence for mindfulness, and Dr. Vo is going to provide that clinician experience and perspective. And finally, we'll end with Virginia providing the patient perspective. Next slide, please. And I just wanted to show you where you can find evidence on pain management on our CADTH website. If you go on resources and then click on evidence bundles, you will see that we have a pain management evidence bundle where all our reports and tools on pain are linked to that bundle. So in case you're interested in more information on pain management, you can take a look there. Next slide, please. So just a little background, I'm sure many of you are aware that nearly 1 in 5 Canadians have a chronic pain condition. And historically, medications have been kind of the go-to thing when someone presents with pain. But as we know, opioids, being one of the medications used to treat pain, have many side effects. They have risk of misuse, dependence, and abuse. And so we want to be looking for alternative ways to help manage people's pain, and our country is currently in an opioid crisis. So we're trying to direct pain management to other sources. And in October of 2018, CADTH did an environmental scan on non-pharmacological treatments for chronic non-cancer pain, and we surveyed different health providers, and they said that they need more guidance on non-pharmacological treatments and the evidence for those in their practice, and kind of where they fit in practice as well when managing people with chronic pain. So we've had numerous requests come in to review the evidence on non-pharmacological interventions. And so today we're going to be discussing mindfulness. Next slide, please. We do hope that this will be a series of webinars on non-pharmacological interventions, and this is just being the first one. So today we're going to focus on mindfulness. And just to provide a brief definition, mindfulness is defined as the intentional and non-judgmental conscious awareness of the present moment. I know Dr. Vo and Virginia will kind of go a bit more into mindfulness later, but just to kind of set the stage for what the definition is for mindfulness as we talk about the evidence. Next slide, please. So I'm going to be talking about evidence from 2 different CADTH reports, and they are featured here on the slide. And to try and make this, just to get you thinking a little bit, I did phrase some true or false questions in here for you to kind of think about as we walk through the evidence very quickly. So next slide, please. So the first question, true or false, mindfulness may improve patients' pain acceptance and depression scores. Next slide, yes, true. So next slide, please. So CADTH did a limited literature search and identified 1 limited quality systematic review. And I just wanted to talk about this limited quality systematic review first before I explain the results below it on the slide there. So this systematic review was based off of a question, and the question that we were looking at was mindfulness versus no treatment. So normally when we have people enrolled in studies that are on pain management, a lot of the time people are already taking therapies, and then we're adding on something. So we say it would have been mindfulness versus usual care or standard of care, where people are still taking other therapies. For this CADTH report, we wanted to look at mindfulness versus no treatment. So someone who's on a wait list or just not receiving any interventions at all for their pain management. So that is a very limited question. And so we only identified 1 systematic review with that search strategy. And what that report found was that mindfulness training significantly improved patients' pain acceptance and depression scores, but it did not significantly improve pain intensity, anxiety, and quality of life. But I just want to reiterate that this is a limited quality systematic review. We do need more research in order to be sure of the result of mindfulness, and there is a lot of information out there for mindfulness versus usual care. That just wasn't the question that we were looking at in this CADTH report. So just be aware that there is more information out there. Next slide, please. So true or false, mindfulness training may not differ significantly from pharmacotherapy for pain management, and it may possibly be more clinically effective. And the answer is true. Next slide, please. So CADTH looked at 2 systematic reviews and 3 randomized control trials from 4 publications. And what CADTH was looking at was mindfulness training with or without pharmacotherapy compared to pharmacotherapy alone. And what was found was that mindfulness training either improved or did not significantly benefit patients with compared to pharmacotherapy alone. So what's really important here is to consider this last bullet on this slide, in that people who were using mindfulness therapy, they never did worse than the people who were on pharmacotherapy. So there wasn't any differences there with mindfulness versus pharmacotherapy. And in the studies that were looked at in this CADTH review, there were lots of different types of pain populations. So there was one report that looked at chronic low back pain, and then there was also quite a few of the studies looked at headache as well. So it's also important to kind of know that isn't generalizable to kind of all chronic pain. There are specific categories of pain that were looked at in this review. And another kind of issue that we have is you may be thinking, well, what do you mean by pharmacotherapy? Are you talking about opioids, or are you talking about acetaminophen and ibuprofen? And that is another limitation, is that the reports commonly didn't describe what pharmacotherapy people were taking. So it's unsure if this is compared to opioids or just other over-the-counter or other prescription medications for pain. And the last piece I just wanted to mention was that there were quite a few trials that were also excluded because they used the word, as I mentioned for the previous reports, usual care. So people may have been taking medications, but they weren't explained specifically in the reports. So they were excluded from this because we were specifically looking at pharmacotherapy. So if usual care was described as the comparator, then it would have been excluded as well. Next slide, please. And so my last true or false question for you today is true or false. There are evidence-based guidelines that recommend the use of mindfulness for the management of chronic non-cancer pain. And the answer is true. And so CADTH reviewed guidelines that were published between January of 2014 and May of 2019. I'm sorry, next slide, please. And identified 3 evidence-based guidelines. And the only guideline that I'm going to mention for the interest of time was our 2017 Canadian guideline, where there was recommendations derived from low to moderate quality evidence that non-opioid pharmacotherapy and non-pharmacotherapy should be used first before considering opioids for pain management. And this guideline also recommends using mindfulness for pain, and it demonstrated small to moderate short-term benefits based on the evidence that was reviewed by the guidelines. So just to kind of mention, I mentioned at the beginning, we do hope to do a series on non-pharmacological interventions for pain webinars, so that we can discuss some other non-pharmacological interventions as well. Next slide, please. So just to summarize what I chatted about with you today, I know I just whizzed right through, but I do need to pass it off to our other speakers today. But just that mindfulness versus waitlist control might improve pain acceptance and depression scores, but based on that one limited quality report, mindfulness didn't improve pain intensity and anxiety and quality of life outcomes. But there is more evidence out there comparing mindfulness to usual care. We just haven't looked at that yet at CADTH. For pharmacotherapy, just to note that mindfulness did not do worse than pharmacotherapy. So just to consider mindfulness's place and role in treating pain, and that we identified evidence-based guidelines that support the use of mindfulness, and to end on the fact that we do need some more research in this area for longer durations of time as well, to kind of see how things follow through in the long term. And with that, I will say next slide and pass it over to Dr. Vo.
Hi, everyone. Can everybody hear me? Can you hear me?
It seems we're still I can hear you. It seems there are still some people who aren't able to hear, but we will be recording this and we can send it out to everybody who registered or send the link to them who aren't able to.
I'll go ahead.
Go ahead.
Next slide, please. Okay, so I'd like to talk a little bit about what is pain first, and then we can better understand how mindfulness can help. So let's think about battlefield injuries, and there's stories that most combat veterans can tell you this, of cases where there's been a bullet wound, for example, but the soldier keeps on fighting, and it's only after the battle that they even know that they've been wounded. So there's clearly a significant tissue injury, but what's going on? Next slide, please. The lesson here is that not all injuries cause pain, or at least not when you think they should. And if we think of pain as a response to tissue injury, it's absolutely true that pain has an adaptive function, but sometimes we don't feel the pain right away because of other factors. Next slide, please. This is another very famous case in the medical literature. This is a case of a person who had been working and had jumped onto a large nail, and it pierced through his foot, came out through the top. He was in excruciating pain. He was rushed to the hospital. He was immediately given pain medication, and his pain was relieved. And then the surgeons removed the boot, and they found that the nail actually didn't go through the foot at all, but it went just between the two toes. And so he hadn't been injured, but the brain had activated his pain in order to protect him and to make sure he got the help that he needed. Next slide, please. So the lesson here is that not all pain is due to an injury as well. Sometimes we can have pain and there may not be a tissue injury, or maybe the tissue injury has healed, or maybe the tissue injury is not what we thought it was. Next slide, please. So what exactly is pain? We know pain is a nervous system phenomena. It's when the nerves register a tissue injury, transmit it to the brain. The brain is the master computer of the nervous system. So the brain regulates the entire nervous system. And the brain can send signals to either amplify or decrease pain sensations in the nervous system. So all pain is ultimately experienced in the brain. And this doesn't mean that pain is not real. It doesn't mean that it's all in your head. But what it means is that pain is interpreted. The nervous system signals are interpreted in the brain, and the brain is what perceives it and interprets it as pain. And what does this mean for mindfulness and for non-pharmacologic strategies? Well, the good news is that the brain and nervous system can be rewired, and this is called neuroplasticity. It means that brain signaling pathways and impulses can be retrained. And when we have the case of chronic pain, that's very important, because often what's happening with chronic pain is that nervous system pathways that cause chronic pain are overactivated. But we can rewire those. And the way that we rewire those is through experience. It's not really through medication. Next slide, please. So what exactly is mindfulness? Mindfulness is getting a lot of attention these days as if it's a new thing, but it's actually not a new thing at all. It's been around for thousands of years. We see the roots of mindfulness in traditions from the East, such as Buddhism and yoga, but we also see something like mindfulness in many other wisdom traditions throughout the world, whether or not they use the word mindfulness. So I think mindfulness is a real universal phenomena, but the way that we are teaching it and learning it in 2019 is strongly influenced from thousands of years of practice in cultivating it through Eastern traditions. In the late 1970s, Dr. Jon Kabat-Zinn at the University of Massachusetts developed mindfulness-based stress reduction. So this is one of the first clinical mindfulness-based interventions, and much of the research that we heard about earlier is about mindfulness-based stress reduction. And then in the 2000s, we saw something called mindfulness-based cognitive therapy, which was an adaptation aimed specifically at depression. And then in the last 10 years, we've seen really an explosion, an alphabet soup of mindfulness-based interventions targeting various systems, various symptoms, different populations, and also it's become much more mainstream. It's become part of the popular culture as well. So this is a relatively new phenomenon, but truthfully, mindfulness has been around for a really long time. Next slide, please. So this is my definition of mindfulness. And I've adapted this from Jon Kabat-Zinn. It's about paying attention in a particular way, on purpose, in the present moment, and with unconditional love. So those first three items are pretty intuitive. It means paying attention with intention and with presence. The last one is a bit less intuitive, the unconditional love, or sometimes it's called non-judgment, or sometimes it's called acceptance. Because when we pay attention to the present moment and we're having a difficult moment, if we're not able to combine that with a sense of non-judgment, with a sense of unconditional love, with self-compassion, then we don't feel better. In fact, we feel worse. So the sense of non-judgment, unconditional love, self-compassion is a really critical part of the practice of mindfulness. It's not only about present moment attention. Next slide, please. So this is just another way to put it. I don't know if Cookie Monster actually said this, but this is a quote I like. Today, me will live in the moment unless it's unpleasant, in which case me will eat a cookie. And this really gets at the counterintuitive nature of mindfulness. And a lot of popular culture descriptions of mindfulness really focus on paying attention in the present moment, but only when it's pleasant, and it's about feeling good. But actually, we need to learn how to pay attention with self-compassion even when we're in pain, and that's really where the power of mindfulness comes. That's not to say it's easy. It's definitely not easy. It's simple, but quite difficult to do, especially when we're experiencing pain, and that's why we have mindfulness training. Next slide, please. This is another quote I really like by Jon Kabat-Zinn. You can't fight the waves, but you can learn to surf. And what this gets at is a lot of the time when we're experiencing pain or depression or anxiety or distress, we're resisting, we're fighting those experiences. But what happens is that actually amplifies the pain. It actually makes our suffering worse. Mindfulness gives us a different way of relating to the pain, one moment at a time, one breath at a time, like riding the waves of the ocean rather than fighting those waves. Next slide, please. This is another equation that we use in mindfulness-based intervention. Suffering equals pain times resistance. And this is worth unpacking a little bit because a lot of the time we think that pain and suffering are the same thing. But if we pay really close attention, we might learn that there can be an experience of pain but not suffering. And perhaps some of you can think of experiences in your own life when there's pain but not suffering. An experience that a mother of mine, a mother of a teenager who had chronic pain, told me about. She said childbirth experience of deep pain but no suffering. In fact, it was a joyful experience. And I asked her, well, how did you do this? She said, well, I breathed with the pain and I embraced the pain. I wasn't resisting. I wasn't fighting the pain. And it turned out that the doctor who was delivering at that time was teaching her mindfulness, but just not using the word mindfulness. So what we see is that pain can be there, but we can make it increase our suffering by the way we resist the pain, by fighting it, by blaming ourselves, by blaming someone else, by wishing things had been different. And these are all very normal and natural human experiences, so there's nothing wrong with any of those. But what happens is if we get in the habit of resisting, fighting, judging, blaming our pain, that increases our suffering. And so mindfulness gives us some awareness of our resistance patterns, and it also gives us an option to relate to our pain differently. So even if the pain may not change, the suffering can change. And when I ask young people, if you could choose to let go of either your pain or your suffering, which one would you let go of? And most people say it's suffering. As a doctor who treats chronic pain, a lot of what I'm dealing with is actually more the suffering of the pain than the pain itself. Next slide please. So I'm not going to show this video for the sake of time, but this was from Healing in the Mind with Bill Moyer's TV special, and I would really encourage audience members to watch it. It's on Vimeo, and you can speed up if you want to about 10 minutes. And what it does is it really demonstrates what it's like to breathe with the pain, to feel the breath, but not thinking about the breath, riding the waves of chronic pain and not fighting the pain. And the picture you see here is a practice called the body scan, where we lie down, we pay attention to each part of the body, one body part at a time, and it's guided by the facilitator. And we invite breath, we invite awareness, and we invite self-compassion to each body part, including the body part that is experiencing pain. And what this does is it helps us to develop a different kind of relationship with our body, a different kind of relationship with our pain. Next slide, please. We also can teach this to adolescents. So this is just a picture of what the adolescent group looks like. I've developed this course called Mars A, Mindful Awareness and Resilience Skills for Adolescents. And this is adapted from mindfulness-based stress reduction and mindfulness-based cognitive therapy for adolescents with anxiety, depression, and chronic pain. And our early results are very promising that mindfulness can be taught and practiced by adolescents as well as adults. Next slide, please. So just a few words about teaching mindfulness, because that's a very common question I get is, how can I teach mindfulness? What's the best intervention? What's the best curriculum? So Chris McKenna, who's a well-known mindfulness trainer, he says your own nervous system is the intervention. And what this means is it doesn't really matter whether we choose mindfulness-based stress reduction, mindfulness-based cognitive therapy. What matters more is the mindful presence and the embodied mindful quality of the facilitator themselves. So I feel really strongly that we can't really teach mindfulness unless we're practicing it ourselves first. Next slide. So this is just a few resources for young people. The CADTH Mental Health Resource Center at BC Children's Hospital has a nice page where they've collected a lot of mindfulness resources. And they've also developed an app called Breather, B-R-E-A-T-H-R. This is a free app on mindfulness aimed towards young people. So those would be good places to start to learn further resources. And with that, I'll turn it back over.
Well, thank you, Dr. Bo. That was really interesting. I really liked the idea of pain and suffering, don't have to go hand in hand or are not the same. That was really interesting. Now we're going to hand it over to Virginia to speak on behalf of the patient perspective and her experience.
Hi, well, thank you. I'm going to start a little bit by sharing where I was on my journey in order for you to understand where I've come by using certain tools. I actually just to kind of imagine you're frozen and you can't move, you can't think, you can't be an active member of your family, your community, your work. Pain is absorbing every aspect of your life. You feel stuck and you're spiraling in a dark hole. That's exactly where I was for years. I started my journey with pain after a shoulder workplace injury in 2008, which led to surgery. So instead of relief, I was left with even more crippling, severe pain. This led me to a 3-year absentee from my career and from family and friends. I was just not present at all. I started spiraling into a state of depression and anxiety as these knives pierced my back. About 2 years into my journey, I was referred to the QE2 Pain Management Clinic here in Halifax. It was here where I was diagnosed with myofascial pain syndrome, hyperalgesia, and allodynia, if I'm saying them correctly. We're fortunate pain clinics also offer a multidisciplinary approach. So this meant I participated in the pain management classes. So this was the first time I was introduced to mindfulness, and it was where I started to gain knowledge about pain and tools to help manage my pain. Ultimately, my pain started to decrease, and so did my flare-ups. But I still wasn't understanding mindfulness very well, or the benefits of it, and I certainly wasn't managing my stress well. At this time, I was learning a lot, so there was a lot to absorb, but it certainly was my first steps, and my steps to moving forward into a positive life again. It was here I was starting to just level that roller coaster a bit. Change the slide, please. All right, next slide. Okay. So this is me with mindfulness at start. It really did confuse me. Yeah, look at the one with the yoga legs on. That just wasn't me. I couldn't figure this out. I couldn't figure out how it worked, how would I practice it, when would I practice it, or if it would actually work for me. So about a year after I completed the self-management classes, I started to see a wellness therapist, and her specialty was with pain. As I said, I was still struggling with the stress and still having flare-ups, and I was just starting to re-enter into the workforce again. It was her that started to work with me with mindfulness again. We started things with audio, visual imagery. She would sit there and do progressive muscle relaxations with me. As I would sit with her, I would start with the muscle relaxations or the body awareness. I would start feeling benefits. But I still was challenged with doing it by myself. And my biggest challenge was the monkey mind. I just couldn't get myself to stop thinking of everything else, and I couldn't figure out how I would do that. What I soon learned was the first thing I had to do was to be kind to myself and not judge. So when I would get upset or I would lose focus and my mind would wander, I would just allow myself to sit and be okay with this. And then it started to come together. So over time, with practice and patience, I developed how to do mindfulness and how to do it my way. I just had to kind of bring myself back. Next slide, please. I learned what works for me. I learned how to do it my way. When I do it when I practice mindfulness when I'm feeling stressed, when I'm starting to have flare-ups. I practice at work. I usually practice at the end of the day. So what I really do is I put it into a routine activity. I practice it daily. I practice before usually doctor's appointments if I'm going for treatments. How I practice? Well, I usually find a quiet place. This could be at home or at work. I set low music. I dim the lights and I close my eyes and I breathe. Mine's about the breath. I just feel my breath in and out. Sometimes I started counting breath in and then counting breath out. And I just feel my chest rise and fall as the breath goes in and out. Sometimes I sit, sometimes I lie down, depending where I am at. As I go off, my mind starts to wander. I just get better and I just bring the mind back. I become aware of the thoughts that are wandering, but I just bring it back. I listen to my surroundings and I have learned to be non-judgmental about it. This was certainly key to bring my mind back. Where I practice everywhere. I practice in my home, my work. When I practice at work, I'll set a timer for 10 or 15 minutes so I allow myself to take some time and I have a quiet little space where nobody knows where I'm at. This is essential at work because this just helps my moods and energy and get it through my day. Over time, I started recognizing my moods, my triggers, and when I needed to practice. It now has just become a part of my routine life. When I'm practicing, I can feel my shoulders come down and relax and the tightness actually decrease. So over time, like I said, I made mindfulness a part of my life. Best advice I can ever give anybody when they start to practice is just be non-judgmental. And I think these are something both speakers have talked about. Next slide. What benefits I found from mindfulness is I've been able to decrease medications and my treatments. I go for trigger point injections, so I've been able to decrease how often I need the trigger point injections. I have a decrease in flare-ups. I've been able to settle my flare-ups down faster. Increase my activities. I participate in family activities. I exercise. I become a valuable member of our community. I'm now a patient advisor, and I facilitate a pain support group, and I am back to work part-time. In emotional well-being, it has improved my emotional well-being. I feel better. I have better moods. I sleep better. And if I wake up, I practice in the nighttime, and I get back to sleep. It helps me stay calm, and it is this that's helped me manage my stress better, which helps with the flare-ups and pain. I've learned over time to take a moment and to do this and not feel guilty about it and not feel guilty about taking time for myself. I required 2 more shoulder surgeries, and this has helped me prior to the surgeries and after during the recovery. I feel mindfulness for me is essential. It has given me a better quality of life. Practicing mindfulness, like I said, has become second nature and a part of my life. This is my personal experience. What I do know as a facilitator of the pain support group, I lead the group through a relaxation, muscle relaxation at the end, and many have had positive comments and found it beneficial. If I were to bet, I would say that most on the line haven't practiced yet, and I would suggest if you're going to suggest it to patients to practice it and understand what it takes and what it means to do it and the benefits. For me, this is just a simple action of being present in the moment without judgment, and this has changed my life. And I thank you for listening. And that is it. I'll pass it over.
Wonderful. Thank you, Virginia. That was fantastic and great to hear how this has worked for you. So recognizing that we, with our technical challenges, we are a little bit behind in time, but we will try to still squeeze in a couple questions. So the first question, and actually, Dr. Bo, maybe we'll start with you from the provider perspective, and then
Sure.
Virginia, I'd be interested to hear from you as a patient. So one question that came in is, are you met with a lot of skepticism when you're introducing the idea or suggest the idea of mindfulness for pain management to your patients? And Virginia, after Dr. Bo responds, do you mind sharing your experience? What was your perception when you were first suggested that? Dr. Bo, I'll hand it over to you.
Yeah, sure. There's definitely some skepticism. I'd say in Vancouver and British Columbia, there's more curiosity than skepticism, and I don't know if it's like that everywhere in Canada or in North America. In terms of skepticism with adolescents, though, I found a couple of things. Number one, adolescents are much more open-minded than adults once they've had some experience with it. So their skepticism can turn into curiosity and can turn into buy-in very quickly once they've had an experience that where they can use mindfulness in their lives. The second thing I've learned is that the way that teenagers get most interested in mindfulness most easily is when their peers are talking about it and when they're seeing their peers and people in their lives benefit from it. So it's not so much, giving them a sales pitch or telling them what to do or how great it's going to be, but it's giving them an experience of how they can see that people just like them are using it. So one thing I like to do is show a video called Mindfulness Youth Voices. This is another video that I didn't have a chance to show, but it's on YouTube, and anyone can access it freely. Mindfulness Youth Voices. It's about 3 minutes long, and it shows adolescents using their own words talking about how mindfulness benefits them. So it's that kind of thing that I think helps get adolescents over that skepticism.
That's fantastic. Thank you. And Virginia, what was your initial reaction or experience when mindfulness was suggested to you?
Well, you remember when this first was introduced to me, I was still having a lot of pain, severe pain, and just learning that I was going to be living with pain. So absolutely, I did meet it with a lot of skepticism. I never thought that this was going to work for me, no. It wasn't until I seen the wellness therapist and we started doing one-on-one that I started to be a little more open to it in practice. And by this time, my pain, had learned more about pain, and my pain was decreasing a little bit. So initially, yes, I was.
Wow, thank you. Sorry, I'm just going up to the next question. Dr. Vo, are there any resources regarding the application or the use of mindfulness or training for managing short-term acute pain? It's a little bit different, but...
Yeah, that's a great question. It's not something that I'm as familiar with, but I certainly know some people are using it. I think it's probably going to be the most useful when you prepare someone in advance for the acute pain. So, for example, if it's a medical procedure, then I think it's something that we can teach in advance, and then once people know how to use it, then they're able to use it in that situation of acute pain. But it's a bit counterintuitive. So I don't think it's something that you can necessarily teach for the first time in that moment of acute pain.
Okay, and actually I'm just going to combine a couple of questions here that we received similar ones. So for healthcare providers who are looking to incorporate mindfulness into their work, what resources are available to them to learn more about it and how to communicate that with patients and basically to get started?
Is that question for me?
Yes, it is,
Yeah.
Dr. Rose, sorry.
Yeah, so I think the number one thing for a healthcare professional who wants to incorporate it is to develop your own practice first, because you can't really incorporate it into your practice until you've experienced it and until it's part of your life. Like, we heard from Virginia that it's just become part of her daily life routine, and it's the same for me. So mindfulness is really more of a way of being, a way of living your life than it is like a technique or a tool, although it certainly has those elements of it as well. So how can a healthcare professional start to learn mindfulness? The easiest way in most areas would be to take a mindfulness-based stress reduction class, MBSR, and most major metropolitan areas do offer that either through the academic centers or sometimes in the communities. The second options are retreats. There's lots of books out there. There is mindfulness training specifically for healthcare professionals as well, and this is really to help us as health professionals manage our own stress, manage burnout, manage secondary trauma, be more present for patients, be more present for each other as colleagues. And there's a lot of great work out of the University of Rochester. They've developed a course called Mindful Practice, which is all about that. So I highly recommend that. And then in terms of other resources and books, Jon Kabat-Zinn wrote a really classic book called Full Catastrophe Living, and that really describes the mindfulness-based stress reduction course. and really describes how we can use mindfulness to address suffering and to address pain. So that would be a good start as well. But the main thing is develop your own personal practice first.
It's a great suggestion. And Dr. Bo, this one's probably a good question for you again. The question is, do you find that a lot of folks equate mindfulness with relaxation? And how would you describe the difference or the distinction between the two?
Yeah, they're definitely not the same thing, and a lot of people do think that they're the same. So that's a really important question. What I say is, with the teens I work with, especially, if I just tell them to relax, they're not going to feel relaxed. They're actually going to feel more stressed. So mindfulness isn't about relaxing per se. It's really about paying attention just as you are and noticing what's happening for you just as you are, whether it's tension, whether it's relaxation. Now, there is a bit of a paradox there because sometimes when we just notice what's happening and we notice the tension, that actually gives us an opportunity to release the tension. But if we're going in feeling that we have to strive for a certain outcome and that outcome is relaxation, and if we're not achieving that outcome, then we failed, then that actually makes us more tense, not more relaxed. So mindfulness is really it's kind of a gentle engagement with the present moment, just as it is. It's not about trying to fix or change things necessarily. So it's a bit counterintuitive.
That's a really great answer. Virginia, from the patient perspective, did you have anything you'd like to add to that?
No, I don't. I think the biggest thing I'd like to add is one thing that Dr. Woad said is people of, if you're going to introduce your patients to it, and I think this is why I connected with the lady who done it with me, was she practiced it, is to practice it. You can't really introduce someone to unless you're really practicing and you truly understand the struggles with getting there.
Okay, and another question. Does mindfulness have different benefits than traditional cognitive behavioral therapy for pain? Dr. Vo?
Yeah, I think mindfulness and cognitive behavioral therapy can go very well together. They are certainly not mutually exclusive, but they are a little bit different. So, one example I can say is when it comes to thinking, a lot of people with chronic pain as well as anxiety and depression have ruminative negative thinking about, this is going to be a catastrophe, my life is over. Your life kind of develops your mind develops this story, which isn't helpful, which worsens your distress and worsens your pain. With cognitive behavioral therapy, what you might be doing is recognizing those thoughts and then trying to challenge those thoughts, try to change those thoughts. Whereas with mindfulness, what you might be doing is recognizing those thoughts, but then developing a different relationship with the thoughts, just letting the thoughts come, letting the thoughts go. You're not fighting, you're not changing, you're just not believing the thoughts. You're just not holding on to the thoughts anymore. Thoughts are just thoughts, they're not facts. So there could be situations where the CBT approach would be more useful, and there could be situations where a mindfulness approach could be more useful. So they go very well together, in my opinion, but they are a bit different.
Well, thank you. And one last question we're going to try and squeeze in before the end of the hour. Can this strategy be used with patients or people with dementia, and if so, how? And Dr. Vo, I'm sure you're the most appropriate to be answering this question, so I'll direct it to you.
Yeah, to be honest, I don't work with a lot of patients with dementia. I do know that there are people who are developing or teaching mindfulness to people with dementia. What I can say is I do work with sometimes with children or with teenagers with developmental disabilities, so they may not be very verbal, they may not be able to have sophisticated use of language, and mindfulness can still be quite useful to them. It just has to be presented in a different way that focuses more on activities, more on the senses, more on the body rather than on thoughts and words.
Wonderful. Thank you very much. And thank you to all for your fantastic presentations today. It was really informative and really interesting. So that brings us to the end of the hour. Apologies again for our technical challenges that we had. We recognize that we did run short on time, so if we weren't able to answer your questions today, or if you'd like any further information, please feel free to contact your local CADTH representative, or you can email a request to events@cadth.ca, and we'd be happy to answer that question for you. Again, you will likely have an evaluation survey for this webinar that should be available to you before you log out of this event. again, please, if you can take a couple minutes to fill that out, it really provides us with an indication as to the interest and the satisfaction of our webinars and suggestions for future webinar topics as well. That's really helpful. So this session has been recorded, so we will make the link available to those who registered today. And other than that, just thank you everybody for attending and have a great day.
Okay, thanks everybody.
Thank you.
Thank you.
Thank you.